Hi, this is Suzette with Home Infusion, and I'm going to review how to administer parenteral nutrition. The handout that I'm going to review is also in your packet of information in your box of supplies. So we're going to begin with what parenteral nutrition is. It provides you nutrients, vitamins, and electrolytes through your intravenous IV line. The nutrition comes in a pre-mixed divided sealed bag that contains white lipids, which is the fat, lipids are fat, in the top section, and clear dextrose sugar and amino acids, which are protein, in the bottom section, as well as other nutrients that are called additives, which are here. There's vitamins, and then there's some trace elements. Because this is your nutrition, it has to contain all of these important nutrients for you. So to start with, you want to store your the bags on a clean surface in the refrigerator away from food. You can only stack no more than 3 of the nutrition bags at one time. Remove the bag from the refrigerator and place it on a clean surface. So you've cleaned your table, we've got the paper towels down. Take it out about 1 to 2 hours before you're going to actually start giving you the nutrition. It needs to be warm, like just room temperature warm. It'll feel better going into your IV line. So we're going to follow the directions on your medication label. So before you begin, then you want to make sure, this is just a test label, so the name of this patient is test. It tells you that is TPN, or total parenteral nutrition, and 3-in-1 means that there's the amino acids, the dextrose, and the lipids, and it's all going to be in one bag. So that's what that means.
Often this is a pale yellow instead of clear, so it can be...
Yeah, this is just a demonstration bag. Good point, because it will have a tint of yellow. Yep. It'll have the volume of your the prescription. So this is all based on a prescription. And then the SMOF are your fats, special kind of fats. So read the instructions. It says remove the separation rod and mix the contents of the chambers. And then we're going to add the multivitamins and the trace elements with these syringes and needles down here in this port here. And I'm going to demonstrate that in just a little bit. So it tells you to add those vitamins, and then it says that this will go over how many hours. So this is based on your prescription. TPN always has a taper up 1 hour and a taper down 1 hour. And this is important because you may not have been eating, and we want to just sort of, give you a little bit of the carbohydrate or the dextrose at a time, so that you don't have like a huge amount going in all at one time, and then all of a sudden at the end we just stop it. So we want to ramp up a little bit, and then we want to decrease a little bit at the end, so that your body doesn't kind of go into a hypoglycemic, like a low blood sugar or a high blood sugar effect.
So it will be infused via your CAD pump, which we will also demonstrate in a little bit.
So again, you need to wash your hands before you start all of these, gathering your supplies for that 20 seconds. Be sure to wash all the parts of your hands, including the tops and bottoms of your hands, underneath your fingernails. Don't forget your thumbs. Make sure you are scrubbing vigorously, because that's what's going to get rid of the germs on your hands. Again, we're not providing gloves for you during this time. We want to make sure you have clean hands. All right, so
we've also got your SAS and your SASH method. There is a video already explaining that, but you will flush with saline before. You'll administer your TPN for however many hours, and when you're done, you'll disconnect your TPN and flush again with saline and heparin if your healthcare provider has recommended that for you.
We'll also be using tubing. This is tubing that gets connected into the pump, and then it gets attached to your IV line and also into here. So there's two ends of the tubing.
These long tubes on either end are used for our pharmacy techs to fill. So the only two ports that you will be using are the port to inject your additives and the port that you will twist off and inject your IV tubing.
All right, we don't have a sharps container here showing you. That's the red container. We'll want you to put these syringes with the needles on the end of those right into the sharps container.